Hello, my name is Joseph Goodman. We're here in Beverly Hills, and I'd like to show you a very interesting case. So a patient came in and he said, I don't feel comfortable. This is how he came in. Everything looks good. It looks actually pretty nice, but he is uncomfortable. His bite is not comfortable. He has jaw pain. What is happening and why is it happening? And look at this. His back teeth are worn down. His back teeth are damaged. So somebody placed veneers and crowns on the front teeth, but he didn't restore the back teeth. So what is the consequences? Look at these. Back teeth completely worn down, damaged, dentin is exposed. That's what's going on. He has a posterior open bite. So all these 8 beautiful veneers are touching. Patient was happy in the beginning until he realized he's not happy because all his back teeth do not touch. What was done here by mistake is that the back teeth should have been done first. So when it comes to smile makeovers, you need to focus on the bite first. How do you do that? You focus on the bite in the back first and then do the front teeth. Because once you do the front teeth, then the back can't be fixed so easily anymore. Because when you change your back teeth afterwards, your front teeth don't bite correctly. So again, he came in, it all looked very nice until we realized the back teeth don't touch, and he was very, very uncomfortable with these teeth not touching, and we realized the dentist did not restore the back teeth, but only the front teeth. So you always have to fix your back teeth first, which is called a foundation, and then your front teeth. So anyways, unfortunately, in cases like these, you have to redo the back teeth first. Once you do that, it impacts your front teeth, and oftentimes they have to be redone. So always go to a bite specialist and focus on your bite. First functionality and then beauty. Thank you for watching.